Hi, welcome to our History 1300 project on the history of race in U.S. racial ideologies in medicine. I'm Ava Leggett,
This is Luke Kennedy.
Jackson Roth.
and we're going to begin our project by covering race throughout the history. So, we're going to start off with some important people in the medical field since the beginning of medical recordings. The earliest date is in 2600 before Christ, where the Egyptian Imhotep described the diagnosis and treatment of about 200 diseases, which is the first recording of this ever happening in medicine. And then we'll skip to in 460 BC, Hippocrates, who is known as the Greek father of medicine, began the scientific study of medicine. In 1762, James Durham bought his freedom and began his own medical practice, becoming the first African American doctor in the United States. And then in 1827, James McCune Smith became the first African American to receive a medical degree in the United States. And a little bit more of race in medicine. Throughout history, minorities have been overlooked and abused in regards to medicine and scientific finding, especially racial minorities. From being exploited as test subjects to being completely left in the dust, racial minorities in America have had horrible experiences in medicine. So, here are a few statistics regarding racial minorities in medicine. For African Americans, people of African and Mediterranean descent are more susceptible to sickle cell disease, and 13% of African Americans report that they are in fair or poor health. And adult obesity rates for African Americans are much higher than those for whites in nearly every state of the United States. And lastly, for African Americans, they have reported higher rates of diabetes, hypertension, and heart disease than other races. And Black children have a higher emergency department visit rate by 260% compared to white children. Now, for Hispanics, 37.9% of Latinos aged 20 and over were obese in 2008, and 14% of Hispanics have been diagnosed with diabetes, compared with 8% of whites. And Hispanic women contract cervical cancer at twice the rate of white women. And lastly, for Native Hawaiian and Pacific Islanders, the diabetes rate for Native Hawaiians is twice that of the white population, and Native Hawaiians are more than 5.7 times as likely to die from diabetes than as whites living in Hawaii. And a few inequities in healthcare, specifically regarding African Americans. Since the times of slavery, African Americans have had the worst healthcare, worst health status, and worst health outcome of any racial or ethnic group in the United States. African Americans and Latino communities are disproportionately affected by HIV compared to other racial ethnic groups, and this has played largely into the stereotype of promiscuity and of promiscuous lifestyles for African Americans. And Black women are 3 times more likely to die in pregnancy and postpartum than their white counterparts, which has led to a lot of mistrust from Black women towards the medical community, and has really shown racial prejudice throughout the medical field. Now for implications of race in medicine.
To start with the impact of racial ideologies in medicine, racism occurs to the medical field today, and there are a variety of examples that demonstrate this. During the outbreak of COVID-19, discrimination towards Chinese people has increased. COVID-19 has the ability to infect anyone, and COVID-19 policies tend to discriminate towards minorities and immigrants. Next, it is also proven that Black Americans are less likely to use primary care than white Americans. This is mainly due to race differences in socioeconomic status and also the access to the primary care services. Black Americans have shown to use the emergency department at higher rates than white Americans. But Black Americans tend to seek through a private physician's office at only two-thirds the rate of white Americans. This is mainly due to higher rates of medical mistrust throughout the medical community. Lastly, structural racism in the medical community has been shown in today's world as well. Structural mechanisms are not the result of certain individuals, but are on the more macro level system that will influence certain racial and ethnic groups. Studies have also shown that minorities have been put in more stressful and fatiguing jobs in the medical community compared to white Americans. Next, a doctor based in Texas, Samuel Dickman, says both overall and government health spending are higher in the US than in any other countries. Yet inadequate insurance coverage, high costing share by patients, and geographical barriers restrict access care for many. This quote from Dickman demonstrates the United States spending on healthcare and the inability to provide it to its citizens in lower socioeconomic communities in America.
Finally, to move on to the implications of race in medicine. Though viewing the history that race holds in medicine as well as the impact it has had over time, it is important to view and value the progress that has been made in the field in order to push towards equality, as well as looking at the next steps that need to be taken to further the field of medicine. To first look at the progress, we want to look at both medical schools and healthcare. Looking first at medical schools, we see that the admissions team at Johns Hopkins School of Medicine has worked to incorporate higher levels of racial minorities as well as women in their medical admissions, much like the affirmative action process that has been going on in universities throughout the past years. This is beginning to become a standard for many different medical schools in order to cater towards the inequities seen between different races. And the idea of healthcare, certain healthcare departments are requiring progress reports to show that they're able to combat racial inequities. Looking at this, healthcare departments are also showing different definitions for how to approach these problems so that they can make next steps to promote equality. And then looking at the next steps in both of these fields, we see that medical schools are trying to investigate how to bring out implications of racism within the curriculum and faculty and moving away from that. These studies have shown different forms of racism within schools, and it stems from the faculty as well as the material being taught, often saying the faculty is non-representative of the people who are attending the universities and medical schools. Now, the understood next step here is to hire a more representative staff, as well as to examine the material that's being taught within the schools and take out anything that is implying racism within the curriculum. And then looking at healthcare, we see in the recent COVID-19 pandemic that both Black and Hispanic individuals faced a higher mortality rate of about 20%. And the same study showed that these races that were holding lower socioeconomic statuses received differing diagnoses and suggested a possible link to the higher mortality rates as seen in the last point. Now, the next step here is taking provisions to minimize these disparities through faculty screening and awareness, which is the best way to continue. In closing, those are all the history of racial ideologies in medicine and showing both the impact and the implications. Thank you for listening, and I hope you enjoyed our presentation. Here are all the citations used throughout our time in research. Thank you.